Sometimes the biggest healthcare decision isn't about finding a hospital or making a doctor's appointment. It's deciding whether someone you love can continue living safely at home and figuring out what kind of support would make that possible. Maybe it's an older parent who is finding everyday tasks harder. Maybe someone is recovering after a hospitalization. Or maybe the family is trying to balance work, caregiving, and everything else life demands. And that's when a simple question becomes surprisingly complicated. What kind of help do we actually need at home? Welcome to Review Remedy by ScoreDoc, where we turn healthcare research into practical information you can actually use. Today, we're looking at 5 best home healthcare service providers in San Antonio, Texas in 2026. We're not simply going to read 5 names. We'll help you understand what to ask, what to compare, and how to choose care that fits the person, not just the brochure.
Before we get to the list, let's clear up an important distinction. Home healthcare and non-medical home care aren't always the same thing. Depending on the provider and the individual situation, home-based services can range from skilled healthcare to assistance with personal activities, companionship, meals, mobility, and other everyday needs. So the first question shouldn't be, which provider is best? It should be, what type of support does this person actually need? If someone has returned home after a medical procedure, their needs may be very different from an older adult who primarily needs help with daily routines. Getting that distinction right can save families time, money, and frustration.
Let's start with Affinity Senior Care of Texas. It's one of the providers featured on ScoreDoc's 2026 list for San Antonio. When evaluating a provider, don't be afraid to describe your situation in detail when you call. Instead of saying, "We need home care," explain what you're trying to accomplish. Does your loved one need help with daily activities? Are you concerned about safety at home? Is family struggling to provide all the support themselves? Are there specific scheduling requirements? The clearer the picture, the easier it becomes to determine whether the service is appropriate.
Next is Alegre Home Healthcare. And here's a question families should ask before services begin. Who will actually be coming into the home? Ask about caregiver or clinician qualifications, screening, training, supervision, and how assignments are handled. Also ask what happens if the usual caregiver isn't available. A reliable backup plan matters because home care isn't just about the service itself. You're inviting someone into a person's private space, often when that person may already be vulnerable. Trust, consistency, and communication matter.
Our third featured provider is Legacy Home Health Agency. One thing worth discussing early is communication with the family. Who should you contact if something changes? How are updates communicated? What happens if your loved one's needs increase? And who coordinates with their healthcare professionals when appropriate? You don't want to discover the answers to these questions during a crisis. Ask them during the initial conversation.
Number 4 is One You Love Home Care, San Antonio. And this brings us to something families sometimes underestimate: scheduling. Care needs aren't always 9 to 5. Maybe assistance is needed in the morning. Maybe evenings are more challenging. Maybe support is required only on certain days because family members cover the rest. Before choosing a provider, make sure you understand the minimum hours, scheduling flexibility, availability, and what happens when your preferred schedule changes. A service that fits beautifully into one family's routine may not work for another.
Our fifth featured provider is Senior Buddies in Home Care. And there's an important question to ask here as well. What does independence look like for this person? The goal of home care shouldn't automatically be to take over everything. When appropriate, good support can help someone continue doing what they safely can for themselves while getting assistance where they need it. Maybe that means help with meals, but letting them prepare something simple themselves. Maybe it's assistance getting around the house. Maybe it's companionship and supervision. The right level of support can be very different from person to person. The family checklist.
So you've got 5 providers on your shortlist. How do you compare them? Here's a 7-question home care checklist worth saving. 1. What exactly do we need? Write down the tasks and support the person needs help with. 2. Is this medical or non-medical care? Make sure you're looking at the right type of service for the situation. 3. Who provides the care? Ask about qualifications, screening, training, and supervision. 4. What happens if our regular caregiver is unavailable? Understand the backup plan. 5. How flexible is scheduling? Ask about minimum hours, weekends, evenings, and schedule changes. 6. How does communication work? Know who the family contacts when concerns arise. 7. What will we pay? Ask about rates, minimums, additional fees, insurance, and which services are actually covered. That last one is especially important. Never assume that every home-based service is automatically covered by insurance or Medicare. Confirm the details for your specific situation.
There's another step families can take before the first caregiver arrives. Do a home walkthrough. Look at the areas where your loved one spends the most time. Are walkways clear? Are there loose rugs? Is the bathroom difficult to navigate? Are commonly used items easy to reach? Is the lighting adequate? You don't necessarily need an expensive renovation. Sometimes small changes can make everyday life considerably easier and safer. And if your loved one has specific mobility or medical needs, ask their healthcare team about appropriate safety measures.
And please involve the person receiving care whenever possible. It's easy for a family to have a conversation about mom, dad, grandma, or grandpa without actually asking what they want. But this is their home. Ask, what kind of help would make you feel more comfortable? Maybe they value privacy. Maybe they want the same caregiver whenever possible. Maybe companionship matters more to them than the family initially realized. The best care plan isn't just clinically appropriate. It should also respect the person's preferences and dignity.
Here's another practical idea. Create a shared care information sheet. Keep medications, allergies, important phone numbers, doctor's information, appointment dates, and care instructions in one place. If several family members are involved, everyone can stay updated. And if the care plan changes, update it. It's a small organizational step that can prevent a lot of confusion.
So, if you're researching home healthcare in San Antonio, today's 5 ScoreDoc listed providers give you a useful place to begin. Affinity Senior Care of Texas, Alegre Home Healthcare, Legacy Home Health Agency, One You Love Homecare, San Antonio, and Senior Buddies in Homecare. But remember, this isn't about choosing a name and stopping there. Ask questions, compare services, verify qualifications and coverage, and make sure the provider can accommodate the person's actual needs and routine.
We've included the complete ScoreDoc guide in today's show notes so you can explore the 5 featured providers and continue your research. Because finding home care isn't really about finding someone to take care of a loved one. It's about finding the right support to help them remain safe, comfortable, connected, and as independent as possible. Thanks for joining us for another episode of Review Remedy. Until next time, start with the person's needs, ask the uncomfortable questions early, and choose care that fits real life, not just a checklist.